thyroid uptake test. Is radiation exposure safe? The radioactive iodine uptake test is a common procedure used to evaluate how well your thyroid gland is functioning. During this test, you swallow a small amount of radioactive iodine. This iodine is absorbed by the thyroid, and the amount absorbed helps doctors assess thyroid function. You might wonder about the safety of radiation exposure from this test. The good news is that the amount of radiation used in a thyroid uptake test is very small. In fact, it is much lower than what you would receive from other imaging tests, like a computed tomography scan. These scans can expose the thyroid to higher doses of radiation, which may carry a risk of thyroid cancer, especially if done at a young age. The radiation dose from the radioactive iodine uptake test is carefully controlled, minimizing any potential risks. No documented side effects or harmful radiation exposure have been reported from this procedure in typical clinical use. This means that for most patients, the radiation exposure from the test is generally considered safe. However, certain precautions are in place. For instance, this test is not performed on pregnant or breastfeeding women due to potential risks to the fetus or infant. It's also important for patients to avoid iodine-containing medications or contrast agents before the test. This helps ensure accurate results and reduces unnecessary absorption of radiation. When we think about the benefits of this test, they often outweigh the very low risks associated with radiation exposure. Accurately diagnosing and monitoring thyroid function is crucial for managing thyroid disorders effectively. In therapeutic settings, radioactive iodine is used in higher doses to treat thyroid cancer. This treatment involves both gamma and beta radiation, with beta radiation specifically targeting and destroying thyroid cells. However, the diagnostic uptake test uses much smaller doses primarily for imaging and functional assessment, resulting in significantly lower radiation exposure. In summary, the thyroid uptake test is a valuable tool for diagnosing and monitoring thyroid disorders. When performed according to established medical guidelines, it is considered safe for the vast majority of patients. If you have any concerns about the test or your individual health situation, it is always best to discuss them with your healthcare provider. They can provide personalized advice based on your specific circumstances.